Hey guys, my name's Megan, or Dr. Megan Ottomeyer, technically, and I was asked to kind of talk a little bit about my career, how I got here, and specifically a little bit about global health and my involvement in that. So I made this video for you guys. Hopefully it's somewhat interesting and maybe you learn a little something. You'll probably notice like one of my cats, Bruce or Dimitri, kind of popping in the background. Sorry, I couldn't edit them out. And hopefully you all enjoy it. So my job right now is that I am a general pediatrics physician at Cardinal Glennon Children's Hospital just downtown in my third year of residency. Next year, I'll actually start specializing in neonatology, which we take care of sick newborn infants. We go to deliveries and help resuscitate babies that might come out struggling. And we also take care of babies who might have complex medical needs, like let's say, heart problems, gastrointestinal defects, and things like that, brain issues. So really just all about babies. To even apply to medical school, you do need to be completing an undergraduate or 4-year or bachelor's, whatever you want to call it, degree. So you do have to go to college. You can major in anything you want. To apply to medical school, you do need to have certain classes that you've taken, like certain types of chemistry and biology. So most people just major in chemistry and biology, but you can major in whatever the heck you want, like French literature, for goodness sake, and just take those classes as extra. And then also during college, you do have to take the MCAT, kind of like during your third year of college, kind of like the ACT here, and that's the entrance exam to get into medical school, and it's really hard. So then in general, you apply, you get accepted, and you go to medical school, and medical school is 4 years long. So the first 2 years are spent pretty much in the classroom and in labs, so learning from lectures and things like that. You do like your basic anatomy, physiology, pathology, pharmacology, kind of learn about disease from books. And then third and fourth year of medical school, you are in the hospitals doing different rotations. Like, you spend a month on surgery, you spend a month on regular medicine, you spend a month on pediatrics, and to kind of learn all the things that you need to know about medicine and practicing medicine, but stuff that you can't learn from a book. So you have 2 preclinical years and 2 clinical years. And then after that, you graduate, yay! And at that point, you are a doctor, but you're not really licensed to practice in any particular area or specialty, and that's why we have residency training. So after you graduate, you're out of school, technically. You're at your first job as a resident, where you match into whatever specialty you're wanting to pursue. So you can match into surgery, pediatrics, internal medicine, family medicine, a number of different things, depending on what your interests are. And then you work as a resident, so you're working as a doctor, but you're still learning about that particular specialty in an intense setting. So as a resident right now, I am taking care of patients, but also I kind of work in all areas of the hospital, not in one particular area. So 1 month I might be in the emergency room, 1 month I might be in the clinics, 1 month I might be on the floors, 1 month I might be on the ICU. So you really get kind of exposure to everything. And even though you're working as a doctor, you do have a supervising physician that can kind of have your back, that you can ask questions, that kind of overlooks things to make sure that you don't kill anybody. That's important. And so it's part of your training, but it's not necessarily school. And so after residency, in whatever field that you're in, you can go out and practice. So you take a certifying exam, which is also very difficult, to make sure that you are boarded and licensed to practice in whatever state that you're in. So after this year, like in July, I could go out and get a job as a general pediatrician, like in a clinic, and do well child visits and things like that. But if you want to subspecialize within pediatrics, or in this works for other fields too, like let's say you want to be a pediatric cardiologist, so only do heart problems within kids, or like me, I want to be a neonatologist, so I'm a special type of pediatrician that works for babies. You go on to fellowship training, which is kind of like second residency, except there's a lot more research involved. You do have more responsibility, less supervision, things like that, but you're still learning and getting exposed to more things in that particular specialty. So really, the learning never ends if you enter medicine at all. But as far as school goes, you just need a college degree and a medical school degree. So that's pretty nice. So my particular path was a little bit different. So I went into college thinking I was going to be an engineering major. Quickly learned that I hated that and changed my major. And then when I was making my schedule, for whatever reason, I saw, oh, if I just take like a lot of credit hours and really challenge myself, I can get done in 3 years instead of 4 years. So I did that. It wasn't easy, but so instead of having 4 years of college, I only have 3 years of college, but still have my 4-year degree. And then when I was applying for medical school, I actually had a really hard time. I got rejected from 8 different medical schools. My NCAP score was only like okay, and just like it's hard to get in. And so when I was still waiting to hear back from one school, I thought, oh, this isn't going to happen for me this year. I'm just gonna have to try again next year. What can I do in the meantime? And my mentor actually had a great research project kind of on the back burner, and I kind of took interest in that. And so I thought, okay, like I'll just go ahead and do this research project, and that would also take a few classes and then get my master's degree, and then reapply for med school. Well, then I hear back from the med school that accepted me and I'm like, oh crud, like I have this like really cool master's project, but they're also saying, hey, come to medical school, which obviously I really want to do. So I worked out a deal with the medical school to give me a year. So instead of going that year, I would go the next year. And in the meantime, I got my master's degree. So usually a master's degree takes about 2 years. I did mine in 1 year, which was also kind of hard, but it was really great experience, and I'm so glad that's how it went. So after my master's, I went to medical school, and then matched into residency at Cardinal Glennon in pediatrics, and then matched into fellowship at Cardinal Glennon in neonatology, and here I am. As far as global health goes, that actually started in medical school. So my 3rd year of medical school, I had an opportunity from my school to go to Kenya for 3 weeks as like a clinical rotation. So, instead of learning at, one of the local hospitals, I went ahead and went to Kenya with a group of med students and some doctors, and we learned at a clinic there. And I just fell in love with it, and thought, okay, this is something that I need to keep doing. So 4th year of medical school, I went back and helped out there. And then also 4th year of medical school, I went to Guatemala as another global health rotation, just to kind of see, okay, is it, global health in general that I like, or did I just like, working in this particular place in Kenya? So it really has become an interest of mine. I'm very connected to that clinic in Kenya, and I'll talk about that in a little bit. But also just kind of that area of the world, like Eastern Africa, and the medical problems that they're seeing there. I feel very, very connected to that. So I really found that global health was just really important to me, and so I wanted to keep doing it. So even as a resident, I kept on. My 2nd year residency, so last year, I went back to that clinic in Kenya to help out with the medical students. And then this year in residency, I went to Tanzania, which is a neighboring country to Kenya, and actually worked at a hospital in a larger city. So a little bit different experience, but same part of the world, and really liked it there too. So my global health experience is basically Kenya, Tanzania, and Guatemala. So I did just want to describe some of the places I've worked, just to kind of paint a picture for you all. First, the clinic in Kenya that I worked at is in a rural area, so in a farming community, about an hour's drive outside of the city of Kisumu in western Kenya. It is in a small, very small village, and it is generally staffed when we're not there by like 2 or 3 people who live nearby, but really they see the most patients when a group like ours comes in, just because obviously more staff means that we can see more patients. There is no running water, no plumbing. We collect rainwater and filter it for things that we need, but otherwise there's no plumbing and very limited electricity. We had a small generator when we were there to supply like the light bulb and a microscope and maybe a few other things. They have recently put on a solar panel, so there should be more electricity there now, but otherwise, we just have to use what we can without electricity or running water. We do, a number of things there, and I won't necessarily go into detail about that, but we provide like HIV and tuberculosis medicines. The government does supply those for the clinic just because these are big health problems. So we do get those funded, so we're able to give those to people, as well as vaccines and other types of medicines, we have our own pharmacy on site to provide some medicines when we can, as well as places to see patients and do small procedures and things like that. Now, the hospital that I worked at in Tanzania was in a city, so it was a little bit bigger, a little bit more crowded, I guess. It's staffed all the time and is, running on its own. We were just there as extra help. So obviously being in a city, they had access to a few more things, like there was running water there was electricity there. We were able to do like some x-rays and some lab work, although certainly not as fast as we can do it here in the United States. Sometimes labs that would only take an hour to come back here, it took several days to come back there. We also couldn't do everything there. We didn't have necessarily ventilators and things like that. So really limited in our interventions that we could do for patients there. But, we were able to take care of more patients. It's not like a hospital here. There's no private rooms. It's one big ward and, 10 beds in a room, and sometimes multiple patients to one bed if we were really, really crowded and needed more space. Which, that was kind of eye-opening. And then also the nursing care is a lot different. So here, nurses have a handful of patients that they take care of. Well, there's fewer nurses, so they might be covering 10 or 12 patients each. So a lot of the nursing care is actually done by the parents. We rely on them to do like the bathing and, a general care of the kids there. And then also, there's no hospital food. If you want to eat, you better hope a family member brings you something to eat in the hospital. So just a very different kind of culture of medicine there. So now I'll get to your questions in particular. So I was actually really impressed with the list of questions that you all submitted. A lot of them were particularly insightful. And one of them was, well, what is global health? When we're saying that, what does that mean? And then also who monitors it? So, global health, you can ask 100 different people and get 100 different definitions. How I think of it is the study of how medicine is done elsewhere in the world. And also kind of this belief that, where you live might change what medical problems you might have, but where you live shouldn't change the fact that you get an opportunity to be healthy. So just because you live in one country or another shouldn't change the fact that, you could or couldn't get good access to medical care and have an opportunity to live a great life. And so, it's learning about those areas and how medicine is practiced and what medical problems are affecting those areas. And also part of, okay, how can we help with those particular medical problems in those places? Who monitors it? There's not really one big entity that governs all of this because there's not a one world government basically, but the World Health Organization is probably the biggest player in monitoring and just in general kind of overseeing global health. So World Health Organization is funded by a bunch of different governments in the world, and a lot of times they are the ones that start initiatives to end big diseases like tuberculosis, malaria, things like that that affect multiple countries. They also kind of hold a lot of the data. So each place in each country is doing their own research as far as what health problems we're seeing and what trends we're seeing, but then the World Health Organization can look at all of that and say, oh, okay, so these are the main trends, and that can help everyone kind of figuring out more about these diseases and other problems that we're seeing. Also, the United Nations, along with the World Health Organization, they work a lot with health equity. So let's make sure that, no matter what country you live in, that, medicine is practiced in an honest and equitable way. And also getting more people access to good medical care, no matter where they live. So a lot of the questions I got were how is Africa affected by this or that? And I do want to reiterate that, Africa is many countries and it's a big place. And I have been to 2 countries in Africa, not all of them. But I can kind of speak to my experience in Kenya and Tanzania, and even in the United States. You go to one part of the country and another part of the country, and they can be very different how they do things. Life in New York City is a little bit different than, life in Jackson, Mississippi, right? So I do want to make sure that's understood. When I was in Kenya, I was in a rural area of Western Kenya near the city of Kisumu. So a lot of the problems that we saw there had as much to do with the country that we were in, as well as the fact that we were in a rural area. In Tanzania, I was in a more urban area in a city called Arusha. And I was also in a hospital, like a big inpatient hospital, rather than a small village clinic. And so the things and the problems and things like that we saw there had a lot more to do with being in an urban area in a different country, but in the same part of the world. So a lot of the questions that I got from you all had to do with what types of medical problems do we see in places like Kenya and Tanzania that we don't see here. So there are a few that we generally see more of over in those areas of Africa than we do see here in the States. One of them being malaria. So we don't necessarily have malaria here in the United States, but malaria is a huge problem, particularly in that rural area of Kenya that I've worked in. So malaria is a protozoan that is transmitted by mosquitoes. So it gets directly into the blood. And the reason we don't have it here is because we don't have the species of mosquito that carries that, bug. But it can make people really sick. There's like nasty fevers. You can have pretty much any symptom that you want, and it can be fatal. So we do see quite a bit of that in that clinic in rural Kenya that I was talking about. Particularly in kids, it's kind of one of those things where like you can get malaria more than once, but the first few times you get the sickest. So the kids are really affected by it. So as a pediatrician, that's where I'm spending a lot of my time. There's also things like, typhoid and giardia and some other like kind of, serious illnesses that we could have here in the United States, but primarily these types of severe illnesses that we see there is due to unclean drinking water. So not everyone has a water filter, and so when they're drinking unclean drinking water, they're at risk for getting more serious types of illnesses like those. Other things too, like complications from like simple types of medical problems, we see a little bit more of. So like wound infection, so like you get a cut on your foot, and here, you'd be able to clean it with clean water and bandage it up, and it would heal up and it would be fine. But there, if you're not able to clean it with clean water and you don't have a pair of shoes and you're walking on it and you're not able to go to the doctor because it's a 2 or 3 day walk to get there, then that foot is probably going to get infected and be a bigger problem than just that cut. So I think it's really important to point out, and I've mentioned this a few times, that poverty plays a huge role in kind of health and health outcomes, both in Kenya and Tanzania. So a lot of that has to do with being able to afford medical care, medications, and then a lot of that has to do with access to medical care. And that can come from a lot of different ways, like whether there's enough hospitals and clinics that are well equipped to deal with certain types of illnesses in the area, or being able to find transportation to those places. It can really make a huge impact on how people are taken care of. And we actually see quite a bit of the same problems here in the United States too. Poverty exists here. Lack of medical access exists here. Like problems affording medical care exist here. And so it really does go to show that we are a lot more alike than we are different, and we are facing a lot of the same problems. We might not have malaria here, but we certainly do have medical problems that are affected very much by poverty. So one of the other questions was, how is technology affecting global health? And I really like this question because I think it highlights the fact that you don't necessarily have to be a doctor or nurse or whatever to help these big global health issues. So technology is huge for us. Being able to get different types of medical equipment to these remote parts of the world, we rely a lot on technology. So first of all, solar power has been a huge game changer in especially the rural areas where we don't have electricity. Like I said, we just got a solar panel at that clinic in Kenya that I work at, and that's going to be huge for us. Also, engineering ways to get clean water to these areas. A lot of initiatives for building wells have been successful, but then also needing to train local people on how to maintain the wells, because a lot of times they break, and then like if you don't teach anyone how to fix a broken well and then leave, well, that well's not very useful anymore. And also like quick water filtration things, making these pieces of equipment and things like that cheaper, lighter, easier to transport to these remote areas is huge. I think also the biological engineering, as far as making better drugs for these illnesses like malaria, or making vaccines for these things, and also better rapid testing and making those things cheaper and easier to get to these areas is a big deal. Even just in my experience, someone was able to bring a portable ultrasound machine. So instead of like a big, hospital grade ultrasound, we were able to hook something up to an iPad and ultrasound some people in Kenya, and diagnose some things that we wouldn't have been able to do without that technology. I think also the spread of information is a big deal, reliant entirely on technology. The fact that we no longer have to, send a book over to, medical schools in Kenya and Tanzania and things like that, and they're able to access online journals, and we're able to communicate with the internet. I think it's a huge deal because we can share information, and, research being done in one part of the world isn't limited to that one part of the world. You can spread it everywhere. So, technology is big, and it can be extraordinarily helpful to the work that doctors, nurses, and people of that sort who are interested in global health do. So don't limit yourself to thinking that you can't help out if you are interested more in like the engineering side of things. So when I saw the final question on the list that y'all submitted, I got really excited because the question was just, how can I help? And that alone tells me that the world is in great hands in the future coming up with you guys. Just wanting to contribute in any way you can, and that was really exciting. So, there's a lot of different ways you can help out with some of the challenges that we see to global health in a number of countries. And kind of like what I mentioned before, a lot of the challenges that we see in places around the world with good healthcare, we see those same problems, here at home, like poverty and poor access to healthcare and things like that. So I think to start, realize that you can contribute to improving global health everywhere by, improving it within your community. If we as a small community of Afton versus a city, state, country, can figure out ways to help problems with poverty and access to healthcare, well, we can use that as a model for other places. So I think there's nothing wrong with focusing our efforts locally, because I think it does have a global impact. Also, thinking of yourself as a citizen of the world, no matter where you're from or what your heritage is, I think is important because, these problems affect all of us around the world. And so it's going to take all of us around the world to make an effort to help them out. And also, I think it's important to take responsibility a little bit for leaving just your sliver of the world a little bit better than you found it. So, you don't have to leave your house, you don't have to leave the country, you don't have to, do anything crazy to just make an impact and know that we're all contributing to making some things a little bit better. Now, for global health kind of problems and how to fix them in particular, a lot of people feel like, oh, I have to become a doctor or a nurse and I have to go to these places and fix them directly. And that's not necessarily true. Like I mentioned before, with technology being such a huge help to us in our mission, I think it's important to know that, we need people who are the engineers, the computer programmers, the scientists in the lab, things like that, to help move that technology forward. We also need people in politics and policymakers that help with funding and help with making us all, as citizens of the world, do a little bit better and make a society where that's possible. We also need people to help in a lot of other ways. These big initiatives, they need fundraising. So we need people who are good at like public relations and stuff, and we need people who can get the word out and who can do all of those things, manage finances, just like really, if you think of any job out there that exists, I think you could probably somehow relate it to the mission of people trying to help with challenges in global health. I think if you want to help out directly, like if you find yourself in a place in life where you can, like if you're a doctor or nurse or physician's assistant or dentist or whatever, I think it's important to make sure that you look very closely at the program or initiative that you're part of. I am very fortunate to know Dr. Banyo, the guy who built the clinic in Kenya, because since it is in his home village, there was this sense of high respect for where we were going and what we were doing, and also knowing that we were meeting the people that we were helping where they were, and it was a two-way street. And in global health kind of missions, they need to be. We learn just as much from the people in Kenya and Tanzania as they might have learned from us. And instead of just, coming in saying this is the American way and this is how we're going to do it and everything else is wrong, and then leaving, I don't think that really helps anyone. I think it's really important that, you realize that the medicine is practiced different everywhere, and it's practiced different for a reason, because it works there. And so there are things that you can tweak and improve and suggestions you can make, but honestly, you just have to know that since if you're not from those places, you really don't have that expertise to say what works for them and what doesn't. Everyone's just doing the best they can with what they have, with where they're at, and I think that that's important to remember. And so going forward, thinking, because I know high school is all about thinking about the future, like college or job or whatever. I think one of the things that might be helpful is, instead of thinking about like, what do you want to be when you grow up, ask yourself, like, what kind of problems might you want to solve in the world? And I think that will kind of open up more opportunities for you than kind of thinking in the box of like what jobs exist and what those jobs do. Because like I said, you can be anything and help with some of these big problems that we're seeing. All right, guys, I think I've dragged on long enough. Hopefully this was somewhat interesting and maybe you learned something. I'm more than happy to answer any questions you might have or address any comments. Feel free to email me anytime. I'm busy, but how long does it take to respond to an email? Honestly, I can do that. And then also, if you want to learn a little bit more about that clinic in Kenya that I work at, you can visit banyoskenyamission.org. It's a good resource just to learn a little bit more about what they're doing. And with that, have a great rest of your day, and hopefully you enjoyed this. Thanks.